Ladies and gentlemen, thank you for your patience in holding. We now have your presenters in conference. Please be aware that each of your lines is in a listen-only mode. You may submit your questions electronically at any time during today's presentation by using the Q&A window located to the left of the slideshow. Directly under that, you'll see a window labeled Resources where you may download a copy of today's presentation in PDF format along with other handouts. It is now my pleasure to introduce today's first presenter, Ms. Susanna Hopzalern.
Thank you, David. Welcome, everyone, to today's webinar. I'm Susanna Hopzalern, Senior Editor with the American Hospital Association. I'm pleased to be moderating today's webinar, The Reality of Labor Trafficking. Labor trafficking is a form of modern-day slavery in which individuals perform labor or services through the use of force, fraud, or coercion. Healthcare providers can play an important role in recognizing and responding to human trafficking victims. Today's webinar will provide you with the tools to identify and respond to potential victims of labor trafficking. Our webinar will begin with a presentation, and we will conclude with a 10 to 15-minute question and answer session. Let me briefly introduce today's speakers. Susie Baldwin is the co-founder and board president of Heal Trafficking. She is also the medical director of the Office of Women's Health, Los Angeles County Department of Public Health. Dr. Baldwin is a preventive medicine physician who works as the medical director for the Office of Women's Health at the Los Angeles County Public Department of Health. Since 2005, Dr. Baldwin has supported survivors of human trafficking through clinical care, research, training, and advocacy. She co-founded Heal Trafficking, an organization that works to expand knowledge about the intersections between trafficking, healthcare, and public health, and advances systems change to improve outcomes for survivors. She became immersed in anti-trafficking work when she provided specialized health care for human trafficking survivors at a community clinic in Los Angeles from 2005 to 12. She's a member of the U.S. Department of Health and Human Services Technical Working Group and has developed the National SOAR training curriculum. She led the development of the Heal Trafficking Protocol Toolkit for developing a response to victims of human trafficking in healthcare settings. She was also invited to give a TED Med talk on the topic in 2016. Our other presenter, Bukola Oriola, is a speaker, author, mentor, advocate, entrepreneur, and member of the U.S. Advisory Council on Human Trafficking. Appointed by President Barack Obama in December 2015, Oriola is also an award-winning journalist and a survivor of labor trafficking. She has dedicated her life to helping others by sharing her story and offering practical solutions to service providers, clinics, community members, and law enforcement on how to help victims of human trafficking. Oriola is a consultant for the Office for Victims of Crime Training and Technical Assistance Center. It's my pleasure now to turn the floor over to Susie, who will begin the presentation.
Hi, good afternoon. Good morning to those of you on the West Coast or in the Pacific. Today we're going to cover a few things. What is labor trafficking and where does it happen? What are some of the health problems experienced by labor trafficking victims? How do immigration status and culture impact patients who may be trafficked for labor? And how can hospitals use trauma-informed practices to recognize and respond to victims and survivors of labor trafficking? And I also want to thank those of you who submitted questions for us in advance of the webinar. You had some really great questions. And to be honest, to answer all of them, to do them justice, would probably take us 3 hours. So we included as much as we could, and then we'll discuss some of those questions at the end of the webinar. But know that it's very hard to cover everything in 1 hour. So think of this as your introduction if it's new to you, and just as a hopefully reinforcement and expansion of your knowledge and understanding if you're familiar with the topic. So what is human trafficking? It was first defined in the year 2000 in the United States by the Trafficking Victims Protection Act, which created a framework of 4 Ps: prevention, partnership, prosecution, and, oh my gosh, I spaced on the fourth one. But it's been the framework for the U.S. government response to human trafficking ever since. And the definition of trafficking that was determined at that time is the recruitment, harboring, transporting, providing, or obtaining of a person by force, fraud, or coercion for the purposes of forced labor or commercial sex. And that includes involuntary servitude, debt bondage, slavery, or sexual exploitation. In one of the more recent reauthorizations of the TVPA, they added the terms patronizing or soliciting as an action that can lead to a charge of human trafficking if the use of force, fraud, or coercion is used for forced sexual exploitation. And I wanted to clarify when we talk about involuntary servitude or indentured servitude and debt bondage, what we're really talking about. So indentured servitude was made illegal in the United States with the 13th Amendment, without outlawed slavery. Nonetheless, it has continued to this day. And debt bondage remains one of the most prevalent forms of modern slavery all over the globe, despite being banned in international law and in most countries. And it's when people are have a debt that they take on in order to get a service for somebody, which may include transportation to this country, for example, and they wind up working for no wages or wages below the minimum wage in order to repay the debt. And eventually, the value of the work they provide far exceeds the amount of their debt, but they still are stuck in the situation and continue to have to work. So one exception to the TVPA is that in sex trafficking, force, fraud, and coercion are not necessary if the person induced to perform a commercial sex act is under age 18. This exclusion does not apply in cases of child labor trafficking. So when we look at the definition of labor trafficking in particular, it's the same thing except recruiting, harboring, transporting, providing, and obtaining for force, fraud, or coercion for the purposes of involuntary servitude, debt bondage, and slavery. And I like to emphasize the role of coercion because it's easy for people to understand the use of force, right? If you're beaten, if you're being raped, if you are being held captive against your will and bound and tied, then yes, you are held captive. But with human trafficking in this day and age and in this country, most victims are actually not held captive physically. There is a tremendous amount of psychological manipulation and psychological coercion that goes on that creates tremendous fear for people and keeps them stuck in their situation, even if they're actually free to walk outside and walk on the street, even if they're free to go into stores or restaurants, and they may still be completely captive to their trafficker because of the psychological coercion, which includes threats of serious harm to, physical harm to them, threats to their family, and abuse or threatened abuse of the legal process, which is extremely important in the current political environment with our immigration laws in the last couple of years. So we think of this as psychological coercion or even situational coercion, and both of these have been demonstrated in courts of law. When we think about, smuggling versus trafficking, smuggling is a crime across a national border. And it's usually a voluntary exercise that somebody engages in to get to a different country. And of course, with all the massive migration going on around the world, some people are paying smugglers, or as we call them in the southwestern U.S., coyotes, to get them from one country to another. Whereas trafficking is not a crime against a state, but a crime against a person, where there's ongoing coercion or control. So one important thing to note is that regardless of how somebody crosses the border, even if they pay to cross, even if they cross illegally, if when they get to this side of the border, they are exploited for the purposes of another person's benefit, they are still a victim of trafficking, and they are still entitled to benefits and privileges if we're able to identify them and support them with legal services. So it doesn't matter if they came illegally, if once they get here, they face a human trafficking situation, which is really important when we're distinguishing what rights people have. And with that, I'll pass it over to Bukola.
Thank you so much, Dr. Susie. Good morning and afternoon, everyone. Thanks for having me today. Right now, my screen, I can't see it, but I have my presentation printed out. So I will be using my presentation here. Oh, thanks. Okay, I got my screen back. Thank you. So I will take it from there about trafficked people. Who could be trafficked? Anyone could be trafficked. An adult, a child, a woman, a man, transgender, and victims of trafficking can be moved across borders or not, because sometimes someone is a citizen of a particular country and the person is trafficked within the country without moving the person to another country or even moving the person outside of the state that the person is. And traffic victims can also be citizens or non-citizens of the U.S. with legal status or not. So sometimes someone could be undocumented and the person could be trafficked. Undocumentation of immigrants sometimes can make the person to be vulnerable to becoming a victim of trafficking. And someone with legal status, meaning the person came into the United States with visas, could also be trafficked. And victims come from different kinds of backgrounds, regardless of their race, their ethnicity, their income, their class, education, religion, or culture. Human trafficking is a global problem. There are various statistics, and these are estimates. So according to the Bureau of International Labor Affairs, 24.9 million people are in forced labor at any time. And among those, 25% are children. So there are lots of kids who are being trafficked around the world. And there are 16 million who are trafficked into private enterprise like domestic servitude, agriculture, construction, and some other industries that may not be mentioned here. And 4.8 million are trafficked for sexual exploitation, while 4 million are in forced labor by states and rebel forces. So because there is war going on in some countries, that could lead to people being trafficked in those countries just because they have unrest in that country. And there are 15.4 million forced marriages. There are, many young girls who are being married off to elderly men or old men for so many reasons. Sometimes these reasons are culturally based, where in that culture, giving a child out in marriage is part of the cultural practice in that culture, but it is a crime. And the U.S. Department of Labor has identified 148 goods from 76 countries made by forced and child labor. In labor trafficking, victims of labor trafficking do experience different kinds of abuse during their trafficking experience: psychological, emotional, and behavioral abuse, verbal abuse, manipulation, coerced to use alcohol or drugs, For example, as a survivor of labor trafficking, I experienced a lot of psychological abuse, a lot of emotional abuse, and a lot of verbal abuse where it made me to become depressed to the point that I couldn't even recognize myself in the mirror. And I didn't know that it was depression I had. I just knew at the time of being trafficked and also abused that I couldn't recognize myself in the mirror. There is also the physical, which could include hitting, slapping, kicking, beating, burning, sexual assault, and rape. I experienced rape. And spiritual, where in some cases is verbal or spells or voodoos to the victim at the time of being trafficked. So, spiritual also depends on the culture, where it's a culture where they believe in, voodoo, and that could be used against the victim to keep the victim under control during trafficking. And what we know about trafficking in the United States, there are all different kinds of estimates, but currently the challenge is that there is more about sex trafficking than labor trafficking. So there is really no reliable estimate for labor trafficking. We find a lot of information on sex trafficking, even when events are being held or educational or training events. Most of the time the focus is heavily focused on sex trafficking and just a little about labor trafficking. So this kind of event is helping to start uncovering more of labor trafficking for people to start knowing more about labor trafficking and identifying it, because without identification, it will be hard to account for the number of victims or be able to do the estimates. And most law enforcement agencies do not recognize it. Prosecutions, there are a few prosecutions, they are very rare. The most recent one on labor trafficking is with Fairness. I don't know if any of you saw that story. Fairness Lipenga, who was trafficked by a diplomat in the DC area, and she got a $1 million award in court against the diplomat who trafficked her for 3 years in her home, working as domestic servitude in that home and threatening and telling her that if she reports, she is the one that will get into trouble instead of her trafficker. So it's still really very hard to uncover labor trafficking. And most educational initiatives, advocacy, and media portrayal focus on sex trafficking, like I mentioned earlier, and the emphasis is just more on sex trafficking. If we start putting more emphasis on labor trafficking, we'll be able to uncover more of those as we go. Polaris did a little book, I think it was sometime last year, called The Typology of Modern Slavery. And you will see on the slide that these are all the different categories where they've gotten calls coming to them for trafficking experience, or whether it's a victim that is calling or someone in the community calling to seek help for a victim of trafficking. And, they had 13 listed here, and you could see that it ranges from domestic work to health and beauty services. One of the places I was trafficked for labor in was a beauty salon here in Minnesota. The healthcare industry, there are some people, and I'm really glad today that we have healthcare professionals here. There are some people who are trafficked even in the senior living or in nursing homes, where the people they are serving don't even know that some of the people who are working there are victims of labor trafficking. Hotels, carnivals, and about almost any place someone is being trafficked, even in homes. So it's so important to pay attention to people when they come in for health care needs to know that even if they're coming from their home, it doesn't mean that this person coming from home is excluded from being trafficked for labor or sex. That person in front of you as a patient with headache or any other thing might be a victim of labor trafficking. And labor trafficking in children. You know, there was the statistics by Covenant House where they found out that 1 in 5 children were identified as victims of human trafficking. And 14% were trafficked for sex and 8% for labor. And 3% were trafficked for both sex and labor. So sometimes a child or an adult could be trafficked for sex and also trafficked for labor. And sometimes it's just sex only, or it's labor only, or it's labor and domestic violence or another crime, or sex trafficking and another crime. And as mentioned earlier with the Polaris typology of modern slavery, you can see here too that, you know, children are trafficked in different places, restaurants, magazine crews. So if you see those kids selling magazine in your neighborhood, please start paying attention, because sometimes some of those kids are trafficked for labor where they are owing the magazine distributor, they're owing for boarding, they're owing for feeding, they're owing for transportation. So when a child is owing for all of this, how will the child be able to survive or even get out of the situation? So when we see those kids come around, we need to start paying attention, because those kids might be victims of labor trafficking. Some are forced to do peddling, some are in agricultural industry, and you know, we'll get into the agricultural industry when we get to the visa types, because some of these people are tied to their employer. It's so easy to get trafficked as a result. You cannot leave that employer according to the law. So that makes the person to be vulnerable and helpless. Factories, Scientology, commercial sex, and pornography, you know, these are some of the places where labor trafficking is also going on. I would like to pass it over to you, Dr. Susan.
Thank you, Bukola. So I want to talk a little bit more about the data we have around trafficking. And Bukola gave us some estimates from the International Labor Organization, which are considered some of the most reliable estimates in the world. But they're estimates. They're done through modeling, and we don't get even country-specific information from that. We don't have any good estimates in the U.S. Some of the best data we have come from the Human Trafficking Hotline and the typology of modern slavery. All of the information gathered on these different forms of trafficking and different places people are trafficked come from that database. But the hotline only reflects the calls that people make to it. So if people don't even know about labor trafficking, they can't call and report a tip. And if somebody is labor trafficked and they don't even realize that this is what's happening, which is very common, as we'll talk about further down, then they're not going to call for help for it. Because we've had greater awareness of sex trafficking in the U.S. since the passage of the TVPA, we see a lot more identification of victims of sex trafficking than labor trafficking, even though around the world we know that labor trafficking is much more common, as the data show us, and that's likely also true in the U.S. So as horrible as the numbers are for sex trafficking that we have, it's probably even worse for labor, but it's even a more hidden population than sex trafficking a lot of the time. So this study in San Diego is one of the good examples of a local study with a specific subpopulation that gives us an idea of how common this might be in certain sectors. So this is a study funded by the National Justice, which is the research brain of justice, And Dr. Zhang and his colleagues surveyed only Spanish-speaking, monolingual Spanish-speaking, unauthorized migrant laborers in their county. So that means they were undocumented. Either they may have had documentation like a visa for work or school or travel that expired, or they came across the line illegally. The average age of these people was 33. They were almost all from Mexico. The remaining 2% were from Central America, and less than 30% of them were proficient in English. Nearly half were female. So this is, again, even of San Diego County, this is a subpopulation. This is not getting the monolingual Chinese speakers, for example, or any other population. But it is a snapshot of this, and we all have immigrant workers from around the world in our different communities. Some of you may not in more rural areas of the Midwest or other places in the U.S. But there's been a lot of migration over the last 20 years, and a lot of us have immigrant workers when we go into restaurants or laundry places, people doing our landscaping. And again, so this study, they define trafficking very conservatively because, again, psychological coercion is a big part of this problem by law. And you can get a conviction by law even if somebody never had a hand laid on them. But in this act, they define trafficking as an act that involves restrictions imposed by the employer on the worker's physical or communicative freedom and threatened or actual assaults to their body. So they were threatened with beating, imprisonment, or sexual abuse, so they actually experienced it. And these were more extreme cases again. And the findings were quite disturbing, that when they examined everything this population reported, they found that 28% of them had experienced threats to bodily integrity and restriction and deprivation, extreme conditions that qualify as severe forms of trafficking in person. And if they opened it more broadly to look at forms of abusive labor practices that are illegal, like deception, well, again, deception and fraud are part of the definition of human trafficking. So those were excluded. Like if you were promised a job doing, say, of being a nanny, and then you wound up being an indentured servant in somebody's house, that's fraud. They didn't count those cases as trafficking. It's normally trafficking. They counted that as an abusive labor practice. Wage theft, which is extremely common in this country for low-wage service workers, and then workplace abandonment, where they might leave somebody. This happens often with peddling, where they take people someplace and leave them without a way to get anywhere safe. Almost 50% of the workers experienced abusive labor practices overall. And when they looked at the industries in which this happened, I ranked these in order of the experience of trafficking, but you can see that the abusive labor practices overall aren't in order. So janitorial and cleaning services had the highest prevalence of worker reports that met the definition of human trafficking, according to the study. 35% of people in construction, 32% in food processing, 28% manufacturing, 27% in landscaping, other, which was a host of other jobs, including domestic servitude, and then agriculture in this sample was the lowest of only 16% reporting trafficking, only 16%. That's actually quite large compared to our population overall. And you can see that this is rather shocking, that people are experiencing extreme forms of human rights abuse in our country. And while they are not citizens, while they are not legal residents, this group of folks, they are all entitled to relief and justice for what's happened to them. And you can imagine, for the most part, they're not getting it. I had the privilege to provide expert testimony earlier this year for a labor trafficking case in Fresno, California. And it was a criminal case, which is very rare in labor trafficking cases in this country. There were 3 victims from Mexico, and they were working for a farm. In Fresno, California is in the bread basket of the fruit and vegetable basket, I should say, of the United States, the Central Valley of California, which is where much of our produce comes from in this country. And these 3 people experienced horrible conditions that rose to the level of human trafficking according to the law. The prosecutor was able to gain a conviction on trafficking for one of the cases. The other 2, because they were mobile and they actually left and returned to Mexico and then came back to their trafficker, The jury didn't quite understand that, but they were the trafficker was convicted for extortion. So this is going on all around us, and regardless of where you are and what businesses are around you, you want to look more closely at what's happening in your community. Bukola mentioned this earlier, that it's not just people who don't have documentation that are trafficked. It's all kinds of people, and I wanted to highlight especially the H-2 visa guest worker program, which is rampant with abuse. So these are agricultural workers and specialized workers brought in other industries such as forestry, seafood, hospitality, and construction. These are the workers that have been brought into Mar-a-Lago in Florida by our president for his hospitality industry down there. They can only stay 3 years, and they must stay with the same employer who got them the visa, no matter how awful that situation is. And some of the abuses that have been reported widely, there's a couple of reports on the internet about this program, that they're charged exorbitant fees to get here. They're recruited for jobs that don't exist. They incur substantial debt. So again, getting to a situation of debt bondage, which is trafficking. Wage theft, being held, they say virtually captive, meaning that they can't leave because they don't have their documents. They can't prove who they are to anybody. And horrible living conditions, and often no access to care. So you may not see these workers because they are detained from care, but some of them do get through, particularly in an emergency situation or a pregnancy situation and other conditions that we'll talk about. So I'm going to transition into labor trafficking and health. And of course, for all of you out there who are working in hospitals, you might be wondering, how might these people present in your emergency room, in your clinics in the hospital, on your wards? So what physical health problems do people present with who are trafficked for labor? Of course, there are the occupational injuries, the wounds, the burns, the falling injuries, and also from being beaten and raped. A recent study that was done by Elise Hopper and her colleague Gonzalez in Boston found that 49% of the 65 labor trafficking victims they had treated at their institute had experienced physical assault. So we're talking about extreme violence. Other injuries are those that, again, you would see in a workplace that might be hazardous. So acute tendinitis, inhalation injuries, acute chemical intoxication, heat stress or heat stroke, cold stress, and untreated infections because of the lack of access to medical care. So there might be a delay in, say somebody gets a wound on the job, they're working as a cleaner or in a factory or in a field, and the wound gets infected because they don't even have the basic supplies to care for it, and they don't get medical care until the wound is festering. Maybe pus is coming out of it, maybe they have a fever, they could even be gangrenous, and then they show up in your hospital. And why did it take them so long to get there? We want to look twice at that. Other health problems that labor trafficking victims may have, if you should see them, of course, musculoskeletal pain from the work they do, repetitive motion injuries, vision and hearing problems due to exposures in their workplace. Dental problems are extremely common in human trafficking cases. Again, consequences of neglected chronic health conditions, so somebody may not know that they're diabetic or they may have asthma that's not treated. They might be malnourished from the very poor conditions that they live in of deprivation. People do get pregnant when they are trafficked for labor, and they may show up with a problem with their pregnancy. They may show up for labor and delivery. People do have sex consensually when they're labor trafficked sometimes, and they often have a high incidence of sexual assault and rape. So you can see sexually transmitted infections in this population, and also pelvic pain. And to emphasize how common it is to experience sexual assault and labor trafficking, people often associate sex trafficking with rape and sexual assault, and it's very true because about 95% of women trafficked for sex, we estimate, have been forced to have sex during trafficking. But more than half of women in a UK study, and these people were trafficked from different parts of the world, and our victims in the U.S. come from literally every continent. We see them in the United States. People are trafficked in from everywhere in the world, and the UK also sees a lot of international survivors. And more than half of the women trafficked into domestic servitude had been raped, had been forced to have sex, and 21% of the women in other forms of labor. So this doesn't even include groping and being forced to do other sexual things against your will. This is literal rape. So the incidence of this kind of abuse is very high. And in the U.S. study I mentioned earlier with Dr. Hopper, they found that 28% of labor trafficking victims, including men and women, reported experiencing sexual violence during their trafficking. The mental health effects, the psychological health effects, the behavioral health problems associated with labor trafficking are tremendous. And a small study I did earlier in my career with this population, and from what I learned from my patients for the 8 years I directly cared for survivors, was that the mental health effects were often the most lingering, the most destructive to their lives. Depression, stress, and anxiety disorders, including PTSD symptoms, feelings of guilt and shame that are overwhelming. People blame themselves for this crime. They think they did something wrong. They're embarrassed to tell their family. They're embarrassed to reach out for support. We see a lot of self-harm and even suicidal attempts, some of which are successful. We don't have good counts on that, but a number of survivors that I've interviewed had attempted suicide during their time of being trafficked, including drinking bleach and other horrific ways to try to harm oneself and get out of a situation. A lot of trouble with sleep, whether it's nightmares, not being able to sleep at all. I even had one survivor that I interviewed who was bedwetting from the trauma she experienced, and she was a young adult when this started again. Poor self-esteem that can affect people the rest of their lives, and of course sometimes substance abuse becomes a problem. It can be because the victim is forced by their trafficker to consume substances, or because they have access to something and they use it to numb what's happening. People who are addicted are more vulnerable to trafficking in the first place. We see this more with sex trafficking these days in the U.S., but we don't want to forget labor trafficking either, because it does happen, particularly with youth. So here's some data that we have from studies. This again comes from the Hopper-Gonzalez study at the Reach Institute. They found that when they compared labor trafficking survivors, this is a trafficking in the U.S., mostly foreign nationals, with sex trafficking survivors, it was a nearly equivalent amount of people had depression, slightly more for the labor trafficking survivors, and 45% had suicidal ideation or did at the time of their interview. PTSD was prevalent in 54% of labor trafficking survivors versus 68% of sex trafficking survivors, but these numbers were not statistically different because of the smaller sample size. So it looks like it's worse in sex trafficking, but it's actually not statistically different. But the labor trafficking survivors did have fewer severe symptoms. They did find that regardless of labor or sex trafficking, if they were abused as a child with physical or sexual abuse, they had a higher level of symptoms. So what happens prior to trafficking can be a very strong driver of the outcome to be trafficked, as well as what one experiences during and after trafficking. And complex PTSD is a condition we see more in trafficking, as people who are experiencing multiple forms of trauma, sometimes by different people, sometimes at different times, and it just compounds over time, so the symptoms become more severe. These kinds of symptoms were less likely in labor trafficking than in sex trafficking survivors. The signs they did see in labor trafficking survivors were alterations in how they perceive themselves, an impaired sense of self-worth, and somatic dysregulation, and we'll talk more about that. So somatic dysregulation, one manifestation of that is somatization. These are when we have unexplained somatic symptoms, when things are described as being all in somebody's head, and these are actually due to complex links between our neurologic, immunologic, hormonal systems, and even our endocrine system. And we're learning more and more about this through evolving science every year, and it's very exciting to finally understand the mind-body connections. And common manifestations are those that you see below. I'm not going to read them because I want to keep us up on time. This is a graph from a site called Coliva.net, which shows the links in the medical literature between all parts of the body, all bodily systems, and the experience of exposure to violence and abuse. And a lot of this is driven by the psychological connections, the connections between mind and body. And I don't think the site has been kept up with most recent literature, but they have examples of literature in all of these categories showing how trauma affects the body. And now I will pass it along.
Thank you so much, Dr. Susie. So recognizing and assessing patients impacted by labor trafficking, everyone plays a role, so it's very important to observe when a patient comes in. So power and dynamics between patient and accompanying person. Is the patient accompanied by somebody and the person is the one speaking for the patient? That is something to pay attention to separate them and speak to the patient alone. And if there is need for interpreting, it's better off to have a neutral person to interpret for the patient instead of the person who accompanies the patient to the clinic or the hospital. So patient interaction with hospital staff, is the patient fearful or nervous or denies that anything is wrong or denies assistance? And sometimes the patient might not even deny assistance, but the patient might be in for something, and when the patient gets in there, if the healthcare practitioner finds out that it looks like nothing is wrong, there is more that is wrong that you can't see right away. An example with my own scenario was that at 27 weeks pregnant, I was taken to the hospital with ambulance. And when I got to the hospital and they put everything on me, they couldn't find something wrong medically. They checked and checked and they sent me back home without digging further for what was wrong. Another time was after the delivery of the baby. It was an emergency C-section and I didn't want to go home, but nobody was asking why I didn't want to go home. Those were cues I was given, but the healthcare practitioners missed it. So sometimes the patient in front of you who is a victim will not speak directly or give you a direct clue. Sometimes it's something that is so insignificant that will be the clue for you as a healthcare professional to know that there is more to this patient in front of us that we need to pay attention to in order to uncover what else might be going on and what else could be labor trafficking. Identifying patients who may be labor trafficked. So there is this, at-risk population to keep an eye on, which are the runaway and homeless youth, youth in foster care who keeps running away, or youth in juvenile justice who keeps running away, to pay attention to them because those groups of people are really vulnerable. Immigrants in low-wage service work are also vulnerable. Undocumented immigrants, patients with limited English proficiency, or even they might not have limited English proficiency. It might be that you do not really understand their accent. So sometimes a patient is speaking the English and is proficient, but because the accent is different, the service provider might assume that the patient is not speaking English or can't speak English well. Native Americans, Alaskans, Hawaiian, Pacific Highlanders, patients with disabilities, or patients with substance use disorders. So it's always good to pay extra attention when these kinds of patients come in. And signs of human trafficking: reluctant to speak. Sometimes, it might even look obvious to you, but the patient will not say anything to you. And the way to get the patient to talk to you is to build trust in the patient. Because even if you have the help and the victim sees the help with you, but if the victim does not trust you, the victim is not going to open up to you. So it's very, very important during that little amount of time or short period that you will have contact with the patient, be that person that the patient will trust enough to open up to. In my own, another example was my public health nurse, because that was how I got help, actually. I got help through a public health nurse. But this nurse had been working with me for over a year before I opened up to her. And even though she knew something was off, she didn't know exactly what was off. But one thing she always said to me was that whatever I said to her was confidential. And her saying that repeatedly gave me the strength to trust her enough to open up to her to get help. And sometimes with victims, some of the things we notice is that their story will be changing, or their stories will not make sense, or they tell you something previously and then you're asking them again, they cannot recollect what they told you before. They delay in seeking medical help because they don't want to get into more trouble, or they're even trying to protect their trafficker. They can't describe where they live or have a specific address, or they don't have their identification documents on them, or they're not in control of their money. So these are some of the signs to look out for. Sometimes they come in with injuries, physical injuries or psychological abuse. And I would like to emphasize here the need to really pay attention to psychological abuse and emotional abuse, because sometimes the patient will not show up with any kind of injury or any kind of physical mark. It will be more of the psychological abuse and the emotional abuse that you will see. And the patient might have been working, excessive hours per day, or working even when they're sick, and working to pay off debt sometimes. Sometimes is that they are not able to communicate with families, they're not able to communicate with friends. I was isolated for 2 years where I only went to Sundays to go to church, because that was the time I was able to go outside of that house. Otherwise, I was peeping through the window. And we lived in the suburb where I see cars going at 50 miles an hour, and sometimes I feel like I should just be in one of those cars and be driven away, but there was no way because I was isolated in the house. And some of them are restricted from communicating with the outside world, with anybody. Just cut them off from, connection in the community. Oh, don't talk to these people. You're going to get into trouble. You're going to get into trouble. So sometimes you might have a victim in front of you, and the victim might not be saying anything to you because the victim has been told if you say something, you're going to get into more trouble. And because this person already knows that he or she is in trouble, the person will keep quiet. And, I mentioned inconsistent story and no identifications earlier. And then for child labor trafficking, often victims of related or concurrent crimes or may appear to be victim of other crimes. And some of those crimes are child employment violations. Do you see a kid that is working? Sometimes there are children who are supposed to be in school, but they are working in U.S. homes. You don't even know until they fall sick. That falling sick might be because the child has been working excessive hours and not going to bed on time, and the child falls sick. But when they bring that child to the hospital, they will not tell you that the child was sick because the child has been working excessive hours. So please be paying attention to those kind of clues when you have a patient in front of you. And sometimes the person is also a victim of domestic violence. And the other crime, like domestic violence, might be what you will see first before knowing that that person is also a victim of labor trafficking. In my case, that was what happened. Domestic violence was what was identified first. It was through further investigation that they realized that I was also a victim of labor trafficking. Child sexual abuse, child abuse or neglect, or sometimes the child is engaged in abnormal activities or not even present in school, or goes to school and goes late to school, or don't show up in school for several days. So for those of you who work in schools as social worker or healthcare, I think the nurse, the school nurse, these are things to pay attention to when you are working with those children at school. And child labor trafficking indicators. If there is a child in school, for example, people come from different cultures and different backgrounds. In my culture, my neighbor is my aunt. I call someone that is my neighbor my uncle, and we are not even related. That is the culture. I call someone that I'm not related to mom or dad. That is the culture. So sometimes a child is living with a family and they have no relationship at all, no blood relationship. But because it's the culture, the child might be calling the person mom or be calling the person dad or aunt. Pay attention to this, because sometimes someone will say, oh, don't worry, I will take care of your child, but that child will not be put in school. Instead, that child will be trafficked for labor. Another example with a child like that is Evelyn Chumbo, and some of you might already know a story where she was living with someone at a young age here in the U.S., and the person was just using her at home to work without putting her in school. And a neighbor might look at that child and think that is their child. Even if she had been brought to the hospital will not know, because they will just think it's their child. Meanwhile, it's not their child, and they're not only abusing her, but they're also enslaving her in the home. Sometimes there is no evidence for legal guidance. So this person is responsible for this child, but there is nothing legal to prove that this person has the right to be responsible for this child. So those are some of those clues you need to look out for. The child might be exhausted because the child has been working long hours with no sleep, and the child might be the one responsible for taking care of the elderly in the house and cleaning the house. They come from culture where domestic workers can be children. In some cultures, some people will take their children to a relative, a distant relative, in that they think, oh, this relative is rich, or this relative can take care of this child. Okay, the child will be there working for that family, and the family in return for the child working might be, oh, sending the child to school. So if someone comes from that kind of culture to the U.S., there is no way for you to know, except when the person is sick and comes to the hospital and you are beginning to see some other signs to know that something is really wrong here. And when someone is living with their employer and they are confined, that is red flag. And when the person fears even talking to you, fears talking to authorities, it's because the person has been threatened about, if you talk to an authority, then you are going to be in trouble. You are going to be in trouble. And sometimes, the person is being threatened, they threaten the person, threaten the family, and it's just important for you as a healthcare professional to pay attention to those things, especially non-verbal cues when someone is in front of you. And just know the fact that someone is a foreign born or they are illegal immigrant does not mean that they don't have rights in the U.S. or they cannot get help in the United States. And I will turn it over to Dr. Susie.
Thank you, Bukola. So unfortunately, everyone, we're out of time to go through this section. You've gotten a good Human Trafficking 101, and Bukola covered a lot of the patient perspective issues that we talk about with the PAIR tool. And I was going to present to you some clinical, some information for clinical response through the PAIR tool. So this was developed by Dignity Health with us at Heal Trafficking and our colleague at the Pacific Survivor Center in Hawaii. And it's a way to provide trauma-informed care to patients who are experiencing any form of violence, but it's very useful for human trafficking. And I'm going to skip ahead to slide 47 just to give you the overview. Actually, I don't know how to get to the number. Okay, I do. Let me just skip ahead here. This is all really key information about how to do this work with patients, how to provide the support they need in the assessment, and what kind of questions you can use. But this is how we overall look at what you need to do. First, understand the basics about trafficking. You now have some good basic information about labor trafficking. Identify people in your hospital who are the champions, who can organize the group, who can push this agenda forward. You need champions who aren't necessarily experts in the topic, but who have some authority in your institution to move things forward with the highest leadership so that there's buy-in. Creating a trauma-informed, respectful environment. The questions you ask are important, but the way you ask them and the environment in which you ask them of patients is the most important thing. Even if you don't know what exactly to say, if you do it in a way that's respectful and non-judgmental and builds rapport with your patients, you're going to have more success. But we do have information here about screening questions. There's a lot of studies coming out about screening and resources. Too much to get into today, but know that the research is growing, and Heal Trafficking keeps people informed about these developments. You want to build upon your existing strategies and tools for intimate partner violence, child abuse, elder abuse, and know your community resources. This is really key. You can't do this alone. You know, in medicine and healthcare, we want to fix people. We want to fix a situation and send them home all better. And that does not happen in trafficking. So we need to lower our expectations. Yes, training is important, but knowing your community is really important. And in the Heal Trafficking Protocol Toolkit, which we released last year, we give a lot of suggestions for how to go about this step by step. If you don't know where to start, this is a great resource. If you've already started but you want to learn more, you can see a lot in here. The major caution I have about this toolkit is that we released it in early 2017, and things have really changed on the immigration front. So in order to have a victim-centered response, we have to exercise a little more caution in reaching out to law enforcement and even our federal partners, because what can happen is you inadvertently get your patient arrested or deported, and that's usually not what we're trying to do when we're providing victim-centered care and trying to get people access to the health care as well as the other services they need and which they have the right to have. So we have ideas of people to reach out to in your community beyond your hospital system, and I'm going to give you, because we have 2 minutes to go. The slides will be available to you, and we can also send out written responses to the questions that we didn't get an answer to do. And let me just bring it to the end here. This is the Human Trafficking Hotline. This is the resource you should have in your phone.
Thank you, Susie and Bukola, for your presentation. And although we have run out of time, you will have the recording, you'll have the presentation, all of the resources that our speakers have provided for you. They will also be able to follow up with you offline and answer your questions. We appreciate your spending time with us today. You will all receive an email link, an email that would include a link to the archived webinar session. And I want to thank our audience for joining us. I want to thank Bukola Oriola and Susie Baldwin for their presentation. You will, at the conclusion of the webinar, see a brief pop-up evaluation on your screen. Please take a minute to complete it so we can serve you better with future educational programs. Thank you again for joining. This concludes today's program, and have a good afternoon.
Ladies and gentlemen, that concludes our presentation. You may disconnect from the phone, log off the webinar, and thank you for joining us this afternoon.